we're back with part 2 of Chapter 11, Altered Mental Status, and we'll be discussing assessment, treatment, and management of altered mental status patients. Okay, if you arrive on this scene, what are your first impressions? What would you do when you're encountering this man on the floor? What does the scene size-up tell you? Can you rule out a traumatic injury as the cause of the altered mental status? Check his ABCDs, do a primary survey, check the AVPU or Glasgow scale to see how they respond, if they respond to verbal commands or pain. Look for clues. Remember that hypoxia and hypoglycemia are the two most common causes of AMS. As we're going through, consider this patient laying on the floor, something to refer to. What other scene size-up issues need to be addressed? Of course, scene safety, looking around, making sure everything is safe. Use standard precautions. Always protect yourself and your patient. Note the number of patient. Is he the only one? Introduce yourself. Ask for consent. If he's unresponsive, of course, we consider it implied consent. Evaluate extrication issues in C-spine. Is he going to need to have a backboard? What extrication issues are you going to encounter? Are you going to need more people to help you get this man out? Note the time the patient collapsed. Ask witnesses. And if there are witnesses who saw the collapse, ask him about it. What led up to it? What was he doing? What happened? See if others, like family or friends, know the patient's history. Did he fall, or does he have a medical condition that could have caused this situation? It's really important that you note the time you arrived. How is this person's airway and breathing? Of course, this is so important to check the ABCDs first. Check the perfusion, check his skin. Is he sweaty? Is he hot? Is he cold? Check his circulation. Check cap refill. Is there any blood or bruising? And you'll find this out by doing a quick assessment. Does this patient have a medic alert? Remember that hypoxia for a variety of reasons and hypoglycemia are two common causes of collapse. Be sure to check his responsiveness using the AVPU. Does he respond to your voice, to pain? And if so, what kind of response? Use your senses. Do you detect smells like a fruity breath, indicating a diabetic problem? Alcohol in his breath? Call for resources. Get the stat bag. Get other people to help. Call for EMS to get him to a higher level of care. Do a motor sensory exam and a higher cortical function test if the patient is alert. And review the pages at 374 and 375 as they are very specific. And some of these exams may indicate a stroke. If the patient is responsive, do a motor sensory exam. First, ask the patient to hold both arms out straight in front with palms turned upward for 10 to 15 seconds with their eyes closed. If one arm drifts downward, the patient has a motor deficit. Secondly, assess the sensation. Ask the patient to close his eyes again. Touch one of the patient's hands or feet. Ask the patient where you touched him. Repeat touching someplace different until all extremities have been assessed. For higher cortical function, ask the patient to hold up 2 fingers on his right hand. Patients unable to do this have abnormality in the higher cortical functions. Do a vocal speech exam. Have the patient repeat a phrase such as "the sky is blue and the sun is orange." Difficulties with this indicate a brain problem. Note your findings so you can pass this along to EMS. Be sure to deal with deficits in the ABCDs. This is so important and basic. Provide high-flow oxygen to patients with altered mental status. Provide sugar if a patient is awake and is diabetic. Consider spinal precautions and provide rapid transport. Going back to using the AEIOU TIPS mnemonic, this can help you to manage your patient. Other important questions that you might want to consider is how you will notify and help EMS when they arrive. Will you send another person to meet them? Is there an elevator if you're not on the main floor? Will you have to assist in carrying the patient along with EMS? Develop your plan. And using the AEIOU tips mnemonic will begin the management of this patient. If you suspect alcohol is the source of AMS, place the patient on the left lateral recumbent position to avoid aspiration if they vomit, and they may. With E, check the mouth for broken teeth, remove and preserve them, check for vomit and remove it to avoid aspiration. Correct to reduce impact of heat and cold by warming the body or cooling the body. If the patient is experiencing an electrolyte imbalance, he or she needs to get to a hospital for electrolyte therapy. If the patient is alert and oriented and you suspect a blood sugar problem, administer 15 to 20 grams of glucose. The patient may have their glucose monitor with them and may be able to test the blood sugar. If they're hypoglycemic, symptoms should resolve in about 15 minutes after you've given them some glucose, and you should suggest a light meal to prevent further problems. If the patient is hyperglycemic, administering glucose will do no more harm. If they have an infection, manage their temperature, clean any wounds you see, and get to care for treatment. For hypoxia or overdose, use oxygen. Maintain the ABCDs, use high flow oxygen, and rapid transport. With uremia, the patient is suffering from uremia should be transported to a hospital, particularly one that can provide emergent renal dialysis. Give both the high flow oxygen and provide for rapid transport for trauma and tumors if you suspect a tumor. As always, document the treatments and responses of the patients, noting the times to help medical professionals assess and treat. It's important to note the times because we're doing vitals and checking how they're changing over time to delineate trends in their care and management. For poisoning and psychiatric issues, maintain their ABCDs, give them high flow oxygen, contact a poison center if you suspect they've been poisoned. And for psychosis, support them and prevent them from harming themselves or others. Get more help if you need it. For seizures and stroke and syncope or fainting, prevent further injury, maintain their ABCDs, use high flow oxygen, activate EMS and rapid transport. I think you're probably seeing a trend here. With seizures, make sure the scene is as safe and as possible for the patient, removing sharp objects, and provide padding as appropriate. After the seizure, use high flow oxygen. If the patient fell during the seizure, consider spinal precautions and head injuries and provide stabilization and assessment. With stroke patients, clot-busting drugs at a hospital, particularly a stroke center, can be administered. In both conditions, maintain the airway and transport right away. With syncope, use high flow oxygen and raise the legs 10 to 12 inches like in patients with hypovolemic shock. Continue to assess the patient and transport them. For long transfer, be sure to pad the body to prevent injury from pressure points. Patients who are violent may not be aware of their behaviors. Stay calm and protect the patient, yourself, and others. Avoid the use of force if possible, as it may cause the patient to be less cooperative. A particular challenge is when use of a cervical collar and a spine board are indicated because of spinal concerns. Use your resources and remain calm. Use AEIOU tips to help you determine the possible cause of altered mental status. Have you noticed AMS patients are treated with high flow oxygen and are rapidly transported, or otherwise these patients are called load and go patients. Remember that the hypoglycemic patient must be alert and oriented before they can be administered glucose. Consider spinal protection in any unwitnessed fall or trauma unless they're shown otherwise. Remember, the focus of seizures is to prevent injury by maintaining as safe an environment as possible. the end of part 2 of chapter 11.